Hi, good evening, and welcome everybody to our Facebook Live event for strategies for diabetes. A lot of great information we're going to cover tonight. This is definitely a don't miss. If you or someone that you know is struggling with uh, this condition, this is definitely information that they're definitely going to want to hear. They're going to want to touch and get access to because we're going to cover a lot of great pieces of information, a lot of great opportunities for someone to learn, maybe a different step someone can take, different opportunities for strategies to lead to a different point of success. So we're going to talk about a lot of that information today and make sure that you are getting the best information you can from what we know. And, I want to kind of share a brief moment of why I'm so passionate about diabetes is because it's occurred in my own family, and I've watched one of my family members struggle with this condition, and it is something that is um, not exciting to watch in any way, shape, or form. It's not an enjoyable process, and it's very difficult to see somebody struggle with understanding what's happening, number one, and going through the system that is actually what we call our standard of care to take care of these people today. It really is kind of scary with all the things that we know and all the research that's out there. There seems to be it's a massive disconnect between what we know and how we can treat this and what um, what we can do to change our strategies and get better success rates and better results for our patients. And for you individuals that are struggling or want to know more about this, we're going to be talking about this right now. So definitely tune in. If you have any questions, you certainly can put them down in the feed of this live video, and we will make sure that we take care of those as quickly and awesome fashion so that you get the information you need. One of the exciting things I would like to announce is I have finished an ebook that we have available to you on diabetic strategies. If you're interested in getting that ebook for free, uh, you can actually get on our website, fill out a contact us, and let us know that you're interested in that ebook, and we will bring it out. We will email it to you. It's a PDF form. You can actually read through it. It's great information. You can read it on a mobile device, a tablet, on your PCs, laptops. It'll be a great opportunity for you to dive in deeper to what the information is I'm going to talk about tonight. So definitely don't miss out on the opportunity to get the ebook, get more information, and I'll cover how to kind of connect with us later on in the end of the video to make sure that if you have an interest of taking it to the next step and entering into an option of doing something different to get a different result, then we will make sure that you have that option. I really want to sit down, talk with you, and share with you even more so what I'm doing tonight, but I'm more on a one-to-one level, really understanding your case and the details that are around it. So with that, we just really want to jump in and get into the information that we have. And I want you to think about, um, especially if you're somebody who struggles with diabetes or has a family member that struggles with diabetes, when we talk about that, just take a moment, see in your eye, think about it in your mind, and ask yourself, what would life be? What could it be? What could be possible if you didn't have diabetes anymore? What could be possible if you didn't have to worry about the management of blood sugar and those types of things? In a lot of cases, this is possible. What would it be like if you could actually reduce the amount of insulins that you're using and reduce the amount of impact that it has on your body? Those are awesome opportunities for you to change and understand exactly what and how. I mean, in the case of the individual that's my family member, I'll tell you, we would jump all over any opportunity we had to learn something new, different, and an approach that we could take that would change and manifest in a reduction of any medications that we're using and a reduction of the long-term wear and tear of the body going through this process that is prevalent in these types of things. So just take a minute, think about that. What would it be like if you had a different option? Because that's what we're talking about tonight is what is a different strategy? Today, 29 million people struggle from diabetes. That's 10% of our population. Any of us, I can't think of anybody that I would even have ever talked to that doesn't have somebody in their realm of sphere of influence that doesn't have or is battling diabetes. And so it's very important to address these types of scenarios. And the reason for that is, a lot of people ask me, why is it so important to get this and get on this new strategy now? Why is it important to really look for the better solution to take me away from the strategy of using uh, oral medicines and insulins to manage this type of a situation, and really take on a different approach. And the importance is this, you know, there's a lot of consequences when you're in a diabetic situation for a long period of time. Individuals who battle this for a long time end up with loss of eyesight, increased cardiovascular risk and heart attack risk, increased risk of kidney disease, elevated cholesterol issues, risk factors. There are higher risk factors for stroke and for cancer and for those types of things. There's poor quality of life. There's a need for constant medication. You know, and that's one of the things I watch our family member go through. And it's very tough to watch this because everything that has to be done has to be planned in a way where there's access to the right amount of food, there's access to the insulin that they're on, there's access to the needles that they need, and making sure that that is something that they can maintain, monitor, measure. It's a change of a lifestyle. And unfortunately, up until you know, what I've seen in our system that we have, it's been a life sentence. It's basically when you get that term or that diagnosis, that is your life sentence. That is going to be, you are diabetic for the rest of your life. And, you know, that's really hard to take. And so one of the things that I saw when I saw my own family member go through that is, how can we really transform that? How can we make it so that that is truly not the rule? Why is that the standard? Why is that acceptable? And how can we do something different? And so we have to go forward with that, and understanding that that's a very important why in why I've done what I've done in our practice with our practice members. And now what I'd like to know is how we are in a position where we can help people across the globe. We can actually, the system that we've developed is something that we can use remotely. So I can run these systems throughout the whole world. And so we definitely want to be able to access those and bring those to you. When we look at, we have 1.7 million new cases of diabetics diagnosed in people ages 20 years old and older. So it's not just an elderly population or a baby boomer population suffering with this. We're talking all the way down to 20-year-olds. So there's definitely an opportunity for you to really touch somebody's lives and give them this information, and just let them see this video and help share it, so we can do that and change some lives, because that's what it's all about. So when we take a look and we talk about, let's take a look at type 2 diabetes, for example. Type 2 diabetes has some very interesting states about it, or actually facts of what we've seen in research. In fact, Harvard and Duke University has completed research that states in their research and in their medical resources that further confirm that it can be prevented, that diabetes is a disease of poor nutrition and poor lifestyle, and then essentially it can completely be reversed. These are studies that are coming out of very high accredited institutions of research, and they're identifying that this is truly not a life sentence, but it's something that can be shifted and changed. The sad part is that we have this research, it's published, and we haven't done anything to change the standard of care. As I walk through the standard of care that we use for the family member that I have that's in this situation, there was zero, absolutely no training about nutrition and lifestyle. There was only training on how to utilize the medications to manage the disease or manage the condition. And that was very, very sad to me, because there are so many different things that we can do to help transform how that body's working. And we want to make sure that we can do that. So when we go forth and we talk about type 2 diabetes, we have to really understand what is the standard of care. You've heard me mention this quite a bit, so I want to go through that. Typically, when you begin with diabetes, you're going to have an oral drug of some type or other drugs to help manage the symptoms that can be related to your condition. You're going to have insulin potentially. And if you don't have it immediately, insulin is something that usually comes later, especially even for type 2 diabetes, because the medicines, actually the effectiveness of the medicines start to wear down, and you have to move into a heavier component of management. You have diet guidelines from the American Diabetic Association that you're given, and you're giving a diet book with medical dietitian programs and workshops that you can take on. And those are all really based on the food pyramid. And so ultimately, in a lot of cases, that's not ideal for an individual that's in this scenario. And so I was very surprised to see the disconnect between research and what we know and what we're teaching. And so we definitely have to bridge that. But there's a lot of myths and there's a lot of what I call lies about diabetics. And when we talk about that, like for example, type 2 diabetes is passed to us through our genes. That's not entirely true. Um, if your dietary choices, if your exercise choices, and if your lifestyle choices were genetic, then I guess that would be a true statement. But in this case, we even have research saying that this is a lifestyle and nutrition issue. Um, then this is not going to be something that's passed down from your genes. Now, the behaviorisms of what you're doing to your body attached to the predisposition of your cells being able, your genes being able to create type 2 diabetes, that would be a true statement. And so if you're doing the same things that your mother, your grandmother has done for years and years and years, well, if you're doing the same things and expecting a different result, we know what that definition is. You've got to do something differently. And that's truly why most people think it's a genetic predisposition or genetic result, is because they've done the same things, the same diet structures, the same activities, the same activity levels, the same choices have been made, and they've gotten the same results. And we ultimately want to get there. There's a better question. And you could have been born with that predisposition for type 2 diabetes, but your genetic predisposition is just one factor of what your health profile is going to be in the future, not everything. And so that's very important to understand. Another myth that I hear about is that it's never irreversible. You never get rid of it. And, there's a well-known quote that goes, if you do what you've always done, and you will always get what you've always gotten. And that's true today and always. If you do the same things, like I just said, you're always going to get the same results. And that's how diabetics stay diabetic. They're doing the same exact things over and over, and they're getting those same results. There can be very specific actions and activities that we engage in that brings on their diabetes. And there's also the same thing, very specific actions and activities that we can do that can eliminate or reduce their effect of diabetes. But once you're diagnosed, they're essentially told it's a life sentence, and you'll never, ever get rid of it. Well, there's now more and more research out there that is proving that it's to us that type 2 diabetes is not only reversible, but in many cases, it's 100% reversible. It can be removed completely, and that's really huge. Another myth that we always hear is drugs are the answer. We are actually in a case where we would have found a cure by now if that was the case. With all the money that's spent on diabetes research and drug therapy, you would think that we would have completely healed the type 2 diabetes by now with all the drugs and the things that are out there. But what we're truly looking at is we're looking at a paradigm that's looking at management. It's looking at how do I stabilize glucose numbers in the body? How do we maintain that? And once we get that formula, we do that for the rest of our lives. And then we actually treat the symptoms and the effects of that long-term treatment plan. So in other words, you enter a treatment plan and then you have counter and secondary treatment plans for the initial treatment plan, because prolonged use of insulin wears on the body, wears on the organs, wears on the nervous system. There's effects that happen, and it's not going to be a great long-term strategy. So we definitely have to address those things. Traditional diabetes treatments are effective. I sincerely wish this was true. I wish this was the case. I mentioned earlier I'm walking through this type of thing with one of my family members now, and I think it's also important that we take a moment to find what's effective. What do you call effective? Do you call effective managing that number and being basically strapped to a treatment paradigm of having multiple levels of either oral medications or insulins to manage that number? And you're always measuring, you're always planning, you're always executing that type of thing. Is that really effective health? Or is our goal to just try to keep your blood sugar under control and maintain it? I believe effective is a different answer. I think effective treatment is when we actually start to reduce the amount of need for the medications that are being used, and we reduce the amount of management that's needed in our lives. So, and ultimately reducing the impact that this condition can have on your body by healing and helping your body's state to change and transform what it's doing with something like type 2 diabetes. And can we do that? Yes, we've had great successes in that. But there's 4 critical factors that we actually address when we talk about that. There's 4 things you've got to understand are critical to address either type 2 or type 1 diabetes. Now, We treat both cases in our office. We have patients today that were type 2 diabetic. After, in fact, I have a case study or a clinical study in my office. It's a patient that we have that he's been a type 2 diabetic for 10 years. After going through our system and health transformation, 6 months after he finished our program, his primary care physician removed the diagnosis of type 2 diabetes from him, and he no longer takes the 3 medications that he used for that. That is an amazing story, and it's a story that we have seen many times over many years. We've been able to really help and transform type 2 diabetes. On the other side, we have patients that are type 1 diabetes that have either significantly reduced the use of the insulin structure to control their bodies and to control their management structures. Or we've also had a situation where uh, we can help and even eliminate, in one case, a lot of things. Now, obviously, we're watching this very closely. We're watching and managing as we go through these processes. And I want to make sure everybody knows that whenever we're doing anything with a diabetic, we're also always including their primary care physicians who's managing their medications as we go through the process. This is not something that is just something you grab onto and go. This is something that's got to be a very effective plan to result in the results that we get, to actually arrive at the results we get. So when we talk about these 4 critical factors, it's very important to understand that, number one, we have to resolve any hormone, metabolic, or organ system imbalances. The reason for this is because one of the major reasons that you're going to have anything to do with type 2 diabetes, you're going to hear terms like leptin resistance and insulin resistance. And these types of things are created because we have to understand that leptin is a hormone that's made from your body's fat tissue. It's created to send a message back to the brain to address the hunger signals that go on in the body. And what happens is, as we go through the process of overeating, our fat tissues create more and more and more of this leptin. It gets into our bloodstream more and more. Our cell structure starts to become less and less aware of it and less reactive to it. And ultimately what we do is we get leptin resistance. We actually no longer have our signals to shut down our need for food. And so it doesn't create a stop to our hunger. And so we create a situation where we're always hungry, we're always eating, and we overeat our structure. In the meantime, what happens is we overproduce insulin to manage the overage of food that's coming in our body. And I'm trying to make this very technically easy to understand. And so what happens is ultimately we're insulin resistant, we're leptin resistant. The control systems in the body are no longer working to help your body manage the control of input that's going to invade the body and knock the system out of balance. And once the system's out of balance, it's a metabolic disruption. It's a metabolic dysfunction. Your body's no longer able to control and understand how to maintain the use of the hormones and to maintain the use of the fuel structures. And ultimately, you create a situation where you're insulin resistant and you're type 2 diabetic. And then you have to take on some of the oral or the standard of care to try to manage that. So that's one thing we have got to do is we've got to address hormone imbalances, metabolic imbalances, and the organ systems, because the organs play a huge role in this. The liver, the kidneys, there's a lot of structure that happens in the body with organs that are involved in the process of managing metabolic control of your blood sugar. And these things have got to be balanced. If there's any imbalances in these, any toxins in these, we've got to address those. So that is one key factor that we do that's very specific to you. You can't do just a general detox and get that taken care of. You can't do just a general metabolic cleanse and think that you're going to really make an impact of this. This effort has to be very specific to you. We utilize specific biocommunication technology that leads us to understand what your specific needs are. And so it's very key. The second factor is identifying the specific foods, minerals, and nutritional support. Now, that's very interesting because one of the things we've come to understand is everybody has different needs of support, different needs of nutrition and mineral structures. Our mineral imbalances differ from the environments that we're in, the diets that we eat, the toxins that we experience. It's different from person to person. And that has to be addressed and identify specifically what you need to address your imbalances in your body. They are different from person to person. A generalized program will not be effective in this scenario. Third issue is elimination of toxins in the body. Today, we are so toxic in our lives. We have over 80 million inputs of toxins daily in our bodies, whether it be from foods that we eat, air that we breathe, fluids that we drink, things that contact our skin. It is amazing the different chemicals, the different toxicities that come into contact with our body, and they ultimately really impede and shift and manipulate how our bodies are functioning today. It is amazing. We call it an allosteric load, and what it is a state where the body is altered from the invasion of the toxins. And everybody, again, is different. Their environments are different. What they do for a living, what they do for their personal lives, it's different. And when you have the differences, you're going to have different effects and ultimately different needs to address. And so that has to be very specific. And finally, activities for metabolic healing. One of the big things that a lot of people do is exercise. Exercise is phenomenal. But one of the things we tell people in our system is initially, it's not something we do first, because it's ultimately, when you think about exercising, it's really made for toning, strengthening, and conditioning. Cardio exercising, all that is, all those types of cross training, CrossFit, fantastic programs meant to tone, strengthen, and condition your body. If you don't have a foundation of a metabolic system that's working well, of nutrition that's actually effectively used in your body, an ability to detoxify as you go through the process, then ultimately you're building on a foundation that's not solid enough to handle the work. And so many times when you're heavily exercising in this situation, you can create metabolic syndromes. You can create metabolic deficits. You can create detoxifications, or toxicities. You can create more problems just from trying to do something that you thought was going to help. So many people I meet say, I've exercised and exercised, I don't get the results that I want to have. There's a reason for that. And that's because your body's not ready for that type of exercise. And we've got to ready yourself so that when you get into that, you get maximum results from your efforts. And so that is really the 4 critical factors that we have got to address when we come through that situation. So, and we have to remember that type 2 diabetes is not a disease of high blood pressure. It's ultimately a disease of a metabolic hormone imbalance in the body. Type 1 diabetes is a little different scenario, although we do a lot of similar treatment plans for that, because we're dealing with many of the same organ structures, many of the same toxicities, mineral deficiencies. They all help how your body functions. So it's really a different approach to really change and transform how that works. So, when we talk about specific food, I really want to be clear here, because from both our clinical experiences, our clients' experiences, and much of the scientific literature out there, we have scoured what you eat really matters. To eat the right things is key for your digestive tract, for your adrenal glands, for your pancreas, for your liver, for other diabetes that are affected. It is key to make sure that the building blocks of nutrition are in the right place and they are what you need. This is key. And again, here in our system, we use a biocommunication technology to identify specifically what foods are really going to create the greatest balance in these organs, the greatest balance in your metabolism. So we don't guess, we're testing the whole way through. It's a significant component of what we're talking about here. So ultimately, when we look at that, we look at an opportunity for you to understand that diabetes is truly a condition in the body that there is hope for. There is hope that we can do something different. It's not something where it's a death sentence or a life sentence that results in some symptoms and some conditions secondary to the treatment programs. It's not a situation where you always have to have oral and insulin-based treatment paradigms for the rest of your life. There are some things that you can do to take a different step and take a different paradigm. There are strategies out there that are different. And I would love to sit down and share with you individually, one-on-one, what those things are for your specific situation. And we can do this, not only can we do this here in our practice ourselves with our local community, but we can do this globally. So if you're interested in any more information on how we can change, how we can take our health transformation system and change and transform your diabetic situation, contact us on our Facebook page at blhcjax.com. I have a fantastic ebook that we've just finished talking very in depth about what I've talked about tonight, about these strategies, these factors, why you have it, how it works in the body. I've covered all these in this ebook. If you want to get a hold of this to read it, it's not a huge book. It's about 30 pages. It's very easy for you to catch on and see. And just contact us via our Facebook or our website. Our website is vlhcjax.com. Our Facebook, you can find us on Vibrant Life Health Center Jax in Facebook. And there's tons of ways to contact us and let us know that you're interested in knowing more about how we can shift and transform the state. Because you can imagine, in 50 days, we can make such a change in your body and how it's working. You will be walking a different life. And that's exactly what we're all about. We provide you faster ways to wellness at Vibrant Life Health Center, and we want to give you access to these solutions. We have searched far and wide. We've traveled, we've trained, we've created an understanding of the technologies and applied them so that we can solve these types of problems with the best information we have possible today. So I look forward to hearing from you. You can put your comments below. You can contact us on our Facebook page, send us messages. We would love to hear from you, talk with you, and connect with you about this issue. Have a great night.